for your Health Watch now. And as always, we are joined by our friend of the show, Dr. Syed Hussain of Trinity Health of New England. Good morning and welcome back, Doc.
Good morning. Thank you for having me.
So we have quite a few topics to get into. First up, we are talking about a brain disorder, and we're also going to be talking about sunscreen safety. You know, it's that time of year where people need to be vigilant about making sure they are applying it and reapplying. But first, we're going to get into the brain disorder. So fans of Billy Joel, a lot of folks were caught off guard when they learned he had to cancel the rest of his concerts coming up due to a diagnosis of normal pressure hydrocephalus. So what is that?
This is a rare condition, Symphony, and it's characterized by excessive fluid buildup around the brain that, if untreated, can lead to walking issues, bladder problems, thinking and memory issues long term. So it's important that it gets addressed. There is a surgical treatment available for normal pressure hydrocephalus, and that's a tube that can help drain some of this excessive fluid, coupled with physical therapy. Again, the good thing is it's a rare condition, but it's a known condition that can occur.
Okay, now how would performing impact this condition?
Now, he may be having some gait issues, walking issues, memory issues, thinking. We don't know the whole picture, obviously. With public figures, there's only limited information that's released. Some of that may have prompted this additional workup, and so it's important that he gets treated, and he may even need physical therapy for quite some time.
Okay, now let's jump into sunscreen. People tend to think that they only need to apply it when it's warmer outside, but that's not the case, right?
No, it's not. So this is very timely, given that we're going into summertime. So it's a couple things that are important for viewers to remember. It's SPF of 30 or more. And more than 50 doesn't really confer additional benefit. So if you're at 30, that's good. The most important thing is be consistent. Apply your sunscreen consistently. Every couple hours if you're outside. If you're in a pool or water, then reapply after you come out. Make sure it's water resistant. Try to protect your skin as much as possible. Try to use shade, especially during the afternoon hours when the sun is at its peak. The rays could be harmful if you don't apply protection. Look out for whether it's mineral or chemical ingredients in sunscreens. Generally recommended by dermatologists is mineral-based. So that's zinc oxide or titanium dioxide that would be ingredients to look out for. If you have any doubts of what to use, because there's so many products out there, speak to your provider.
All right. Now, for folks with darker skin tones, a lot of people tend to skip out on sunscreen because they feel like their natural melanin protects them, but it only does so much, right?
Great question. So yes, melanin is protective, but it can only go so much, as you said. So even if you have darker skin, it's advisable that you still apply sunscreen, because we know based on data, Black Americans, for instance, will get melanoma, but the mortality is higher compared to non-Black Americans. So long story short, yes, please do apply sunscreen.
Okay, and the way that some of those moles or signs can show up can look a little bit different in people with darker skin tones, right?
That's right.
Okay.
Absolutely.
All right, and a reminder for folks who wear makeup, you can put it under your makeup. I wear mine underneath my makeup every day, especially because I'm using like different skin treatments and skin creams.
Sure.
So
Consistency is key.
Consistency is key.
Yes.
All right. Thank you so much for joining us,
Sure,
Doctor.
absolutely.
And if you missed any of that, we will have it for you on our website. Still to come this morning,